It was during my baby shower. My aunt asked me to move a chair, and I went to bend and move it, and I felt a strange pop in my chest, followed by severe pain. I was considering staying for my shower, just because the guests had just arrived, and I felt bad leaving, but it kept getting progressively worse.
She gave me a call. I asked her to come to the emergency room. But I kind of insisted on doing a CT angiogram.
I at first said no, I didn't want any radiation to hurt the baby, and he insisted.
I got a call from the radiologist saying a large type 1 aortic dissection.
When you see the nurse crying when they deliver the news and tears in your doctor's eyes, then you know it's something pretty serious.
The thing I really can't erase from my memory is seeing the look of death in everyone's eyes.
I spoke to a cardiovascular surgeon who suggested that there are 3 people in the United States he would trust his wife with. One of them was Dr. Girardi at NewYork-Presbyterian Hospital.
You know, from the minute a patient dissects until they get to the operating room, the risk for dying is 1% per hour.
So they took her in a helicopter about 20 minutes later and flew her to New York-Presbyterian.
We need to stabilize her, and we needed to get her safely and quickly to the OR at New York-Presbyterian to save her and the baby's life.
You really can't do this kind of case without great teamwork. I mean, we needed anesthesia and critical care on our side to be ready to take the patient from the ambulance, from the helicopter, get her stable and ready for the operating room, and then also get OB down to start putting a fetal monitor on the mother and monitor the baby. How's he doing through all of this?
We take care of the high-risk obstetrical patients. When I first got the call about Julie and her condition, or when we hear those words put together in terms of a dissecting aortic aneurysm and pregnancy, the first thing, honestly, you think about, you're worried about potential life-threatening situation for both for mom and for the baby.
The surgical aspects of it, you know, if you do it often enough, you want it to be as routine as possible. So fixing Julie in this particular case wasn't really something I was terribly concerned about. I was more concerned about how I was going to coordinate with the obstetricians to deliver the baby.
The details of the actual delivery were quite well planned out. I mean, Dr. Girardi and I have talked about this because we were worried about the bleeding. We were worried about the kind of anesthesia that she needed for either surgery, and that if she needed general anesthesia and needed to go to sleep, that this would have an impact in terms of the baby.
And I was so scared, but he walked in and I felt like I just felt peace.
They're putting their life in your hands, and you have to always respect that. You know, once we had Julie sort of ready to go onto the heart and lung machine, then we had to step back and wait and now deliver the baby.
And all of a sudden, hey, you have a son and a wife going through heart surgery. So it was just difficult to grasp the fact that he was here and he was my son. And
everybody did their job. Everybody did a great job.
The joy that I personally get out of obstetrics is that I feel like, you know, in being here, you can make a difference in a life for somebody.
I hadn't held Max yet. For 6 days I wasn't able to hold him after the surgery. And without me even asking, they thought to bring him to me and let me hold him, which was priceless to me. Things are going really well. We're focusing on Max growing up now.
every once in a while she has a concern and we're able to call Dr. Girardi's office.
Dr. Girardi's PA, Kim O'Brien, is amazing. She's always there for me.
She's been doing really well. Each week kind of brings different things and different stages of recuperation. That's what we're here for. We're here to support her in her ongoing recovery.
We're just so fortunate that she was sent to New York-Presbyterian, and you know, we didn't even know how fortunate we were until after the fact, and we got there and we saw the level of service and the technical expertise of every department. I don't think there's anywhere else in the world where, you know, they could have dealt with this type of situation.
I literally owe my life to them.